Everyone, is my it's working. Hello everyone. In the preview it said my microphone was not working, so I was freaking out a little bit, but it seems to be working. Can I see chat like this? Barely. So I'm trying a new, well, sort of the same setup, but I have the bar a lot lowered, a lot lower, which means that there is a shadow on my face because the bar is right here. But it's also blocking my chat screen. Hi mom, how are you? So I'm just gonna have to deal with that. Hello. I feel like I start every stream with a recap of the latest thing I bought. We tried the hot sauce last night that I ordered. It was very good. It was very, very good. It was a creamy garlic hot sauce. So the package said it was 3 out of 5 like flames. So I was a little scared, but it's like the lowest in the scale of the game. Well, I guess it's a game. Hot Ones, like the show on YouTube. And actually, it wasn't that bad. I think the creaminess really helped. But I also bought. Sorry, I keep trying to look at chat. Hi Eric, how are you? That sounded very dismissive. Hi Eric, how are you? I also bought a tofu press because I've been wanting to eat more tofu. I've been seeing a lot of recipes that look delicious that have tofu, and I know you're supposed to press it, so I bought one, and I'm gonna try that today because we're gonna try to make it tomorrow. We're gonna press it overnight. So excited about that, really excited. But what I'm also excited about, hi Dries, is this game today. It's been a while. We are playing Medical Mysteries, which is a co-op game, which means we all work together as we try to save a patient. There's 2 games in this line so far. We've already streamed almost the entirety of Medical Mysteries New York Emergency Room, so you can find that on my YouTube. And now we are playing the Miami one, which I have right behind me. And that comes with 4 new cases, ranging in difficulty, and these are supposed to be a little harder because the last 2, one of which we're going to play today, has the expert difficulty. So we'll see what that means for us. Basically, in the game... Oh, I just realized I need a patient sheet. In the game, you're going to get an envelope like this that has a patient on it with a little text. And it's going to tell you... Huh? There's no sheet. It's going to tell you a little bit about the patient and their complaints, and then the game is going to give you actions that you can take to try and find out what's wrong with the patient, and then also hopefully so diagnose them and hopefully treat them. And it's going to give you, with these actions that you do, it's going to give you codes that you then look up in this little book. And it's going to give you, that's going to give you another prompt. And usually it'll tell you to draw some sort of story card. And that'll, prompt it along. Let me just try to find, that's strange that it didn't come with, it's supposed to. It says it on the back, what it should have. Patient intake interview, story card, status card, epic sheet. Oh, wait, huh? Is it not supposed to have... Usually it comes with a... what's it called? Like the chart that we write in. And even though I set everything up just now, I forgot to look for that one. That's weird. Does the fourth one have it? Spoilers for patient number 4. This one also doesn't seem to have one. Huh? That's so strange. I think I just threw the other ones out. Huh? Yeah, patient form. Does this come without a patient form? Patient 2 has one, patient 1, the tutorial. Yeah, patient form. Oh wait, it's supposed to be in here. It says that 4 does have it. Whoa, this is some great content. Streamer looks for... You threw it out. Yeah, I mean, I'm gonna try to sell this. This is the epilogue sheet. It's empty. Spoilers. Well, we'll save that. I'm gonna try to sell these, so I'm not gonna, sell my answers to the next person. Well, boo. That is annoying. Is it just in here somewhere? This was all in a package, but... Okay, well... we don't really need it. I can use a substitute. Okay. We'll use a substitute. So you can only do 2 actions every time before your patient gets an update. But we don't. The codes for that update will be on the status card that I do have. So as long as we keep in mind what time it is and stuff, it should be fine. It's really dumb that I threw the other ones out because now I don't have any anymore. So I don't even have an example. That's very strange. All right, anyway, so before we start, this game was made by a designer, husband and wife. They're both the designers and the artists. They're called Rebecca Blue and Nicolas Cravota, and it's published by Identity Games. And I saw that they're making more, but apparently it's being licensed now, so that's all of that is taking a lot longer, apparently. But there are plans to make more, which I'm very excited about. Yes, Mom, the patient forms are also available online. But that doesn't help me right now because I don't have a printer. So we're just gonna do with some old-fashioned pen and paper, and we should be fine. All right, so this is the first time that we're playing it like this, because before my lovely husband made photos of all the cards and everything, and then uploaded them in OBS. And now he doesn't have to. I know that this text is a little small to read for y'all probably. And now you can get to see the booklets that I use. He does sound nice. He's very nice. But I'm hoping you'll be able to read the cards though. Let me see if I can do something about this light. Wait, did I post it online? I don't think I did. No, I did. Hashtag profesh. Okay. Does this help? Still trying to mess around with lighting. Let me try this. Let me see how long these last too, because it might not. And I can't control this one with the app because it's not connected. Okay, whatever. Does this help any? Is this too much light? No, there's a glare. Ugh. Maybe I'll turn this one off. Does it help if it's higher? No, now there's just a higher glare. Alright, well, I'll turn this one off. That's a very strong magnet. Just had to fight. Okay. Without further ado, we have got another patient to save, people. Let's get on it. So, this is patient number 3. Oh, wait, what? Please note this patient is played in combination with what? I should have read this. This was right in front of me. This patient is played in combination with patient 4, John Doe, as the two patients arrive at the emergency room simultaneously. This doubles the game's duration. Oh. I don't know if I have time for that because I have board games later today, but we'll see. Is that why we only have... Okay, wait. Great preparation on my end. Oh my gosh, that means that this is the last game. Boo. Eric says board game sounds nice. Yeah, it's with Eric and someone else who isn't here. He's no longer with us. Hopefully he is. Oh, there we go. This is a bigger one. Oh, because they're both together. All right. Then why was it listed in the other one? Okay. Okay. Stressed. Suddenly stressed. Okay. Anyway. I guess we're saving 2 people today. This shadow is really annoying. Okay. Your next patient is Senator... Can you read this at all? Yeah. Is Senator Carmen Perez. She's a busy woman in the middle of her re-election campaign and thinks there is something wrong with her heart. The hospital is very short-handed today and she has very little patience. Quickly, open his envelope and check the contents. Leave the epilogue sheet in the envelope. You will also need the result codes booklet and a 4 research sheet. Yes, well, I know. All right, well, putting that to the side. I don't know if should I immediately do this one? Oh my gosh. Okay. Okay, so, does this help for y'all at all? Is this something? I don't know why it won't, like, auto-focus on my hand. So it's a little blurry, I'm sorry, but I will read it. You are due to end your so Senator Carmen Perez, age 57, yes, female. You were due to end your shift, but the hospital is extremely short-handed today. The emergency room is packed with incoming patients, and the director has asked you to stay for another shift. It's going to be a long day. To top it off, one of your patients is Florida Senator Carmen Perez, and she is not pleased. Do you know how long I've been waiting to see someone? She says. I could have died. Isn't this an emergency room? You apologize and explain how busy it is. You ask why she's here. I'm finally taking a day off from campaigning, and all of a sudden I'm feeling chest pain and I'm having trouble breathing. My husband is off in Texas on a building project, so I drove myself here. I'd like you to check my heart. You can't read this at all, so. Nurse Judy steps into the room. I'm sorry for interrupting, she says, but you're needed immediately in room 202 to assess a potentially life-threatening situation. My situation is life-threatening as well, says Senator Perez. As you get up to follow Nurse Judy, the senator says, Where are you going? I was here first. There isn't time to argue, says Nurse Judy in a low voice, intended just for you. It's a potential drug overdose. Senator Perez stands, obviously overhearing this, and says, You've got to be kidding me. You're going to prioritize a drug addict over a civil servant who might be having a heart attack? Nurse Judy nods to you to leave while she steps in between the two of you. Senator Perez, she says as she grabs a clipboard, let me take down the details of your condition. You rush to see what is happening in room 202 as Senator Perez says, This is unbelievable. You people are giving me the worst headache of my life. Take status card 1, which is called Racing Heart. Then open envelope for patient number 4, John Doe. Eric says, she's not getting my vote. No, I know, right? Yes, I am prioritizing someone else over you, and I might continue to do that if you keep up this attitude. Extra instructions. So for this shift, you will be treating 2 patients at the same time. You get 5 actions every 2 hours. Okay, so scratch what I said earlier. Each time you choose an action, decide which patient you are treating and choose an action from that patient's status card, then write it on your patient form. Note, the actions for both patients go on the same patient form. Important! When it is time for an update, remember to read the update for both patients. Start with the update for Carmen Perez and then read the update for the other patient. Well, okie dokie. So, not reading this yet, because we've got John Doe. Don't scare me like that. How to best spook a streamer. Say, I can't hear you. Okay. Patient intake interview. So this is him. Oh wait, let me read what it says. Just after Senator Carmen Perez arrives at the ER, another patient is brought in after a call about an overdose. This patient does not want to tell his name. His unwillingness to cooperate is going to make this difficult. Quickly open his envelope and check the contents. Yeah. Alrighty, so we've got John Doe, because he won't give us his name. Look at this troublemaker. He's got dyed hair, and you know that it's, he's a troublemaker. Age, question mark? Male. I mean, I would also maybe say make sure you open and read the intake interview and the EMR of patient number 3 first. Okay, we're reading this first. So, this is the electronic medical record. We've got Senator, that's a very glary. We've got Senator Carmen Perez. She's 57, female. She's 170 meters and weighs 58 kilograms. And her occupation is politician. Her complaints are a headache and chest pains. No recent illness. Recent travel, yes. She's allergic to iodine. And she's on a few medications. So that'll be good to... I don't know why this won't focus. It's annoying. It focuses here really well. But I don't know if y'all can read that. So she's on... Last time I get to do this, y'all. Fluticasone, lisdexamfetamine, omeprazole, and tolvaptan. These are fake. This is not real. We've got some, vitals, and her blood pressure and respiratory rate, I think, are abnormal, or a little more abnormal. They're yellow. Her blood type is B+, past medical history, GERD, seasonal allergic rhinitis, autosomal dominant polycystic kidney disease, and ADHD. Family history: mother, high blood pressure, father unknown, died in an accident when she was a baby. Well, but wouldn't her mother know? Anyway. Social history: married, lives with husband, has 2 adult children, works as a senator, never drinks alcohol, smoked for 2 years as a teenager when talking about tobacco, but none since then. Okay, that's oddly specific. Would you still have to mention that if you are 57 and you've smoked for 2 years when you were a teen? I guess maybe. In the admittance exam, so general complaint, she's alert, oriented, she has a headache and chest pain. Her vitals, her blood pressure is high, other vitals are normal. Psychiatric, she's agitated, respiratory, clear to osculation, listening with a stethoscope. Her head, ears, eyes, nose, and throat. Extraocular movement intact. Eyes are not yellowing. Patent nostrils. No cervical lymph. No swollen lymph nodes in the front of the neck. Neurologic. Strength is 5 and 5 in all extremities. Cardiovascular. Regular rate and rhythm. No murmur. Elevated blood pressure. Her musculoskeletal, normal muscle, no joint pain, abdomen, no tenderness, bowel sounds in all 4 quadrants, and in the extremities, there's no swelling, it's non-tender, skin is intact, no abdominal pain, vomiting, or diarrhea. Then she has those medications. If it's spray or capsules. If this becomes important, I will mention it then. And her last physical exam was 6 months ago. She had high blood pressure. Patient says she has white coat hypertension. Will make at-home BP checks and follow-up in 2 weeks. No follow-up visited noted. All right, she was supposed to have a follow-up, but she didn't do it. Okie dokie. So it comes in a little thingy. Unwrap the cards. Oops, that was a spoiler. So we've got John Doe over here. So now we're going to read John Doe. The patient in room 202 is alert but seems lost in his own world as he reaches out into the air with his fingers to touch nothing. He looks to be about 19. His nose is runny, his forehead is damp with sweat, and he shakes his leg frantically, all typical symptoms of someone experiencing withdrawal after taking Narcan. The ambulance driver catches you up on what has happened so far. We received an anonymous call about a drug overdose. The caller said they had given him Narcan from a nasal spray, but hung up before the 911 dispatcher could ask how much had been given or what drugs he had taken. When we arrived at the location, we found this kid alone in the street, vomiting up his guts. He's clearly aware of what's happening around him, but he's uncooperative and wouldn't answer any questions except to say someone beat him up and stole his wallet. "What's your name?" you ask. No answer. You wave a hand in front of him, his eyes following your hand briefly, but he ignores you. You can see a laceration on his head, and he seems to be favoring his right arm, rubbing just below the wrist with his other hand. You reach out to touch him, and he knocks your hand away. He flinches at the movement, then puts his hand on his back, as he winces. "When was the last time you had something to drink?" you ask. At that moment, you hear a phone ring. The young man reaches into a pocket and pulls out a phone with a cracked screen. It's an incoming call. He sends the call immediately to message. "Why'd you do that?" the ambulance driver asks. He doesn't answer. You suspect that even if you took his phone from him, it would still be passcode locked. No clues to his identity there. The young man shivers, and he looks like he might be ready to throw up again. The ambulance driver says, "I gotta head out. Busy day, as you know. Good luck with your John Doe." You'll definitely need that good luck. How do you help someone who clearly doesn't want to be helped? Take status card 6. Overdosed. 6? Oh, okay. John Doe is overdosed. So we don't have an EMR for this guy. Is that correct? No, we do. Alright, John Doe. We think he's about 19. Whatever, height and weight. General pain all over. There's a laceration in his forehead with some light bleeding. Right arm unknown, back unknown. So he has some problems there. We don't know anything about his travels or whatever. All his vital signs are all right. Don't know anything about this. So during the admittance, he's alert, disoriented, non-cooperative, does not answer questions, disheveled, underweight, pain all over, appears to have been roughed up, bruises but no obvious broken bones. Vitals are normal. He's moody and non-cooperative. His respiratory is normal. Yeah, so his eyes are not yellow, patent nares, no cervical lymph nodes, no non-cooperative, does not answer questions, regular rate and rhythm for cardiovascular, no murmur, muscular skeletal, non-cooperative, does not answer questions, appear to have back pain, abdomen, bowel sound in all 4 quadrants, extremities non-cooperative, skin, bleeding facial lacerations, right arm wounded. Notes, reported overdose and reported Narcan use. And we don't know anything about his last exam, obviously. Alright, so we have 2. So decide which patient you are going to treat first and choose an action from their status card and write it down on the patient chart. It also goes to explain that John or Jane Doe is the name given to patients when they don't know their identity. Okay, so gonna need a lot more space than I thought. We have got John Doe and Senator Carmen. Can you all read this or no? Who should we treat first? So, status card 1, then open a patient. So I guess we don't have a story card yet. Usually we start with some story cards. Can't read it? Well, I can't really solve that, I don't think, because I can't lower it more. Let's first, by the way, I don't know what that Narcan was. Maybe it's in the drugs thingy. Narcan counteracts opioid, yeah, overdose. Effective for 30 to 120 minutes. See rebound overdose. Okay. Can cause sudden withdrawal symptoms. If given to a person with opioids in their systems, and patient may... Can cause sudden withdrawal symptoms if given to a person with opioids in their systems, and patient may act angry. Narcan has no effect or side effects on people who have no why is that such a hard word? Opioids in their system. Rebound overdose. See rebound overdose? Well, I'm trying to see. I don't see it anywhere. Is that under conditions? Rebound overdose. Occurs after an opioid... Oh god, I'm gonna struggle over that word for the entire stream. Opioid overdose is treated with naloxone, and the naloxone wears off before the original opioid levels in a patient's system drops below overdose levels. Closely monitor patient for at least 2 hours after naloxone use to catch and treat a rebound overdose if it happens before more serious effects can occur. Treat with another dose of naloxone. And I'm assuming that's going to be one of his things. Yeah, that's one we can do. Okay. So we get to take 5 actions. So we have to monitor him for 2 hours to make sure that he doesn't do it again. So Eric asks, which blood tests finds drugs? So we want to treat him first. I'm hearing. You'd think I remembered which. Well, he just has a drug panel. We can also blood test synthetic opioids. I hate that word. Blood test synthetic opioid. That one isn't mentioned in the booklet, weirdly. I'm also worried about his back hurting. But I guess we should see what drugs he took, right? That seems to be the most important one. So let's do that. Okay, so we are going to... So I'm going to say John Doe for the first action, and we are going to blood test drug panel. Drug panel. It says to move the... So it says to flip the card, and since we're still at the first 2-hour block, we get JTG. C result code BWF. Okie dokie. Don't know. BWF. If you have revealed a card with an I, take a story card. Otherwise, take story card 57. We have not, because we haven't revealed any cards, so it's going to be 57. Oh. What? You step out of the room to gather what you need for your chosen action. As you pass the nurse's station, another medical professional asks about drug interactions for their patient. The situation is complex, so it takes a while for you to answer a question. When you are done, you return to the examination room to find the John Doe alone, lying unconscious on the floor. Who knows how long he's been like this? You are unable to complete the current action. Cross it off on the patient form and take story card 63. Oh my god. Sorry for being helpful. Oh my god. The John Doe is unresponsive. His arms are limp. You check his pupils and they are constricted. His face is blue and he is not breathing. Code blue emergency. You are unable to complete this action. Cross it out on the patient form. Consider this time slot used. If your next action does not result in emergency resolved, ignore the action and take story card 71 instead. What the hell? Okay. Code blue. Okay. Well, that's starting out great. Should we give him another... I mean, he's not breathing, so we need to, you know, bring him back to life. Bring him to life. Oh, you know what? Before we forget, I want to look up... Where's legal? I want to look up if we have to... Okay, a person in need of medical care for drug-related overdose may not be arrested with exclusions. Okay, that's good. I wanted to know that. That's what I was wondering. Yeah, I thought CPR or something, but that's not on his card. Oh, it is, sorry. Yeah, we're doing CPR. CPR, which is AEB. I was looking for something else, and I only saw like the little knife, and I'm like, surely that's not AEB, right? Yeah. AEB. If you are in the middle of an emergency, which we are, CVMM. Go to VMM. Take story card 74. Oh my god. Everything is stressed. Everything is stressful. Emergency. Okay. Chest compressions followed by mouth-to-mouth resuscitations are exactly what's needed. The John Doe suddenly takes a breath on his own. Emergency resolved. Woo! You check his heart rate and it's low. His breathing is slow and shallow as well. Ah, ba, dera, jara, he mumbles. Oh, he's just playing Star Wars. He is not clear of danger yet. Emergency! Choose another action as part of this same action. Are we just in another emergency? Did we just go from emergency resolved? Okay. If the procedure does not end in emergency resolved, ignore the procedure and take story card 69 instead. Okay, so we get to do something else. And he is not clear of danger. I think now we should give the Naxalone, right? Because I'm assuming that that's what's happening right now. A rebound overdose. Okay, so let's say we're going to give him, as a part of the same action, as I said, another round of naloxone, which is WLA. If you have revealed a card with a bed, which we have, see GKP. GKP. If you have revealed a card with lips, CNEA. Okay, well. You call for naloxone. Nurse Judy retrieves a nasal spray bottle from a nearby cabinet. As you lift the John Doe's head, she inserts the bottle tip into his nose. Emergency resolved. Take story card 66. Story card 66. The John Doe relaxes. It looks like the worst is over. You realize that the previous dose of Narcan he was given must have worn off, and he is having a rebound overdose, since at least one of the other drugs in his system is still at overdose levels. The naloxone you just gave him will stabilize him. He no longer needs continuous monitoring. Emergency resolved. Take story card 60. Oh, kid, what is wrong with you? The John Doe suddenly sits up, his eyes wide. Where the hell am I? He looks around the room like a wild animal. Who the fuck are you? You step closer and he pulls away, shouting, Don't fucking touch me! His gaze darts from side to side. Then he gets up, ready to run. Ah! He yells, bending over in pain. My back! He grabs his side and his face turns a little green. I feel like shit and I'm in a lot of pain. In addition, all the activity has torn open his facial lacerations and he's bleeding profusely. Take both status card 2, Racing Hard and Pissed Off, and status card 7, Rebound. Then take story card 1 and 51. Oh my gosh, it's so much. Okay. Goodbye, story card 6. We've never had 2 story cards at the same time. Or, sorry, 2 status cards. Oh, wait. Status card 2 is her. So, she doesn't have a racing heart. She has a racing heart and is pissed off. Sorry, that's funny. And he is in Rebound. Well, if you're pissed off, you're still alive, you know? Alright. Sorry. And then we take story card 1. And 51. So now we can interview them, basically. So, spend 1 action per 2 questions. So I'm wondering, because one of the actions we can... Oh no, never mind. Right, so he is bleeding. She might be having a heart attack. I do want to stress that. Like, it could very well be... let me look up heart attacks. Is that not a condition, a heart attack? Heart health? No. So for her interview, it says, Senator Perez is extremely agitated. Your intuition tells you to avoid making her any more upset than she already is. And for John Doe, it says, if we want to interview him, while he's still clearly affected by the drugs he's taken, you suspect the young man is more aware of what's happening around him than he's letting on. So wrong then. That should be an A. So we can ask him what's his name is, what his name is, how we can reach his parents, what drugs did you take, what happened, why are you bruised, may I see your arm, how can I help, what do you need? And for her we can ask, tell me about your heart, what drugs are you taking, do you check your blood pressure, do you check your blood pressure at home? Sorry, I thought it said did. I see you have polycystic kidney disease. Have you had any symptoms lately? And tell me about your campaign. Has it been stressful? So to remind us, I want to ask her why there was no follow-up, but I think I actually know the answer probably to that. Ask her about her heart. We know what medication she's taking. Let me look up those meds she's taken, by the way. Tests. Drugs. So, fluticasone relieves seasonal and year-round allergy symptoms. Okay. Lysedexamine treats ADHD. Side effects include vomiting, dizziness, increased heart rate, and blood pressure. Overdose symptoms include dilated pupils, confusion, panic. Can cause positive for amphetamine on a drug test. Oh, that's just to hide the fact that she's using amphetamines. Omeprazole decreases amount of acid produced by the stomach. Treats GERD. Side effects include headache, vomiting, stomach pain. And tolvaptan slows kidney function, decline from polycystic kidney disease. Side effects include vomiting, trouble breathing, stomach pain. Okay, so nothing really for her heart. But yeah, let's focus on her for a second, since he's now sort of stable. So, tell me about your heart. So ask. 1. And we can ask her 2 questions, by the way. So what else should we ask her? So we can ask her about her heart, what drug she's taking, if she checks her blood, if she checks her blood pressure at home. We can ask her about symptoms for her polycystic kidney disease. The second one, I feel like we know that. Or we should. BKX. You want to ask her about the campaign and if it's been stressful? I feel like that's sort of a no-brainer. Of course it's been stressful. But this game might sometimes just, throw things at you. I kind of want to know about her disease. Maybe that's a red herring. CXV. But, okay, so the first one is BKX. My back hurts. I need a doctor. BKX, take story card 2. Oh, okay. So, she says, "It's about time you asked. I feel like I'm having a heart attack. You're going to take my blood pressure again? Look, I have what they call white coat hypertension. That means my blood pressure always comes in higher when I'm in a hospital. Never fails. But that's not the problem. What does it feel like? Aren't you a doctor? Don't you know what a heart attack feels like? Oh, all right. I've got chest pains. My heart is racing. I'm sweating and have chills. You know, a effing heart attack." Why does she need us? If she's a doctor. And we have some sort of icon. Alright, and the other one was CXV. I'm sure if we get too many of these, it's like, she's pissed off and blah, 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 blah. Take story card 5. I mean, not to be a doctor, but isn't she just under a lot of stress? Alright, so we are asking her about her kidney disease. She says, "My polycystic kidney disease is under control. I take some pill for that. tolvaptan or something like that. My regular doctor keeps an eye on it. I'm not worried about that. It's my heart that's acting up. She stops talking and holds her chest, taking a few deep breaths. It's racing and I can't seem to get it to slow down. Alright, that was unhelpful as usual. Should we ask a cardiologist, or do you think they are just gonna say that we need to do some tests? We need to do some tests. I feel like if we call in a psychiatrist, she's gonna get mad. It might be a panic attack, yeah. That's also what I'm... or just, you know... We can do an EKG. EKG. So an EKG... It's a simple, painless, and quick test that records the heart's electrical activity. An EKG recording of these signals look like wavy lines. These lines can show abnormal heart activity that may be a sign of heart disease or damage. Even though she did say that it always comes out higher if she's at a doctor. We have a lot of options we can do. It's weird that it's unclear for y'all because it's really clear for me, but maybe that's because I'm seeing it in 4K and y'all are probably seeing it in just HD. So, and it won't focus here, unfortunately. So we can ask questions. There are a couple of blood tests that we can do. We can do a brain CT. We can do an EKG. There's 2 types of MRIs we can take, a toxicology screen, and we can ultrasound the kidneys. We've got CPR, but, you know, she's fine for now. There's a few meds we can give her, and we can ask some specialists. Yeah, I'm also thinking EKG, even though, yeah. Okay. I'm so bad at filling out the notes. I'm always like, whatever. So we're gonna treat her again, and we're gonna do an EKG. And that, so flip the card, EKG. That's XCM. What? The test comes back normal. No heart irregularities are detected. Then I don't think she's having a heart attack. Regularities. What a word. Alright. Then... Okay, so this is the action that we're going to take now is going to be the last action we get to do before we get an update on both of them. Do we want to ask for a cardiologist for her? Or do we want to go back to him for now? Because we're, you know, I mean, she's getting pissed, but... Back to him? Okay. Do we want to interview him? Or do we just want to run a drug panel test? Well, he's bleeding, right? We know that he's bleeding. He's bleeding profusely. It's kind of bad that he's bleeding profusely and we went back to her. We're like, good luck with your bleeding. Let's fix his face. Let's suture him up. What kind of hospital are we that someone's just bleeding and we're like, no, that's CCH. Yeah, I didn't miss it, but I got distracted. Take story card 88. Feels like something we should have dealt with, right? He's just sitting there bleeding, and we're going, anyway, tell us about your kidneys to this other lady. All right, card 88. He looks rough. Look at him. You clean a laceration on his head. The John Doe starts to resist you. You say, I need you to calm down. You're bleeding and it needs to be stitched up. He stops struggling, allowing you to apply 7 sutures to close the laceration. 7? That's a lot. So we have 2 little symbols. So that is covered. Should we keep these in the order that we get all of them? Okay, now it's time for an update. So we have to read hers first, which is YWX. YWX, take story card 23. She's mad. Look at that face. How nice of you to see me, says Senator Perez. How's the drug addict who keeps getting to cut in front of me doing? She holds up her hand. I don't really care. No shit, she says. I'm going to make some changes over my next 4 years in office. It's absolutely criminal that a drug addict, an actual criminal, gets priority over a contributing, tax-paying, law-abiding citizen. I bet he pays nothing for his visit. That's because productive people like me are footing his bill while we have to wait to get urgent medical care. She waves her hand in front of her. Don't get me started on how the American medical system is broken. It'll just make my headache worse. She is lovely. So nice. All right, and his update is AKT. You find a John Doe sitting up in bed, scratching his left arm. His phone rings, showing a call from Mom. You say, "Why don't you answer it?" He says, "It's obvious, isn't it? I don't want her to know what's happening." You start to ask a question, and he says, "She's so controlling. She even said that I couldn't dye my hair." You point to his blue hair. You point to his blue hair. "Well, she said I couldn't dye it red. She said nothing about blue." Are we sure he's 19? Maybe he's 12. He frowns, grabbing his back and wincing. "I dyed it a week ago. She hasn't even been around to yell at me." Oh, are you just trying to get attention from Mom? That's sad. All right, well, at least he's awake. Why is psychiatrist not an option for him? Because I feel like he needs one. Okay, so it's now 2 p.m. What should we do? So he was bleeding, but he's fixed now. She's annoyed. I should try to get should we just, get a cardiologist to go see her? Maybe that'll, ease her, make her feel better. Logist, which is going to be TNF. TNF. Here, take story card 21. Yeah, Mom says maybe she'll shut up. Exactly. No, we need to help her, even if she sucks. The cardiologist comes to Senator Perez's room. She says, "See, a woman. That's on me. If you're worried about a possible myocardial infarction, we can try an EKG. However, it's your blood pressure that concerns me. You need to get it lower fast. The cardiologist turns to you. You have a number of options, including labatol, lisinopril, and sodium nitro. I'm not saying that on the stream. The best one, of course, depends on what else is going on. Okay. What's the nitropupus. Well, I don't know what's going on. That's why I came to get you, and I already did an EKG, and the EKG said there's nothing. In Dutch, that's a word. I didn't know that was a word in English as well. Oh, my back is really killing me suddenly. I don't know why. I think I'm slouching since I'm just saying. Okay. These lights are very warm too. It's gonna be fun to stream in summer. Gonna find out what that's like. Anyway, enough complaining. While there's fake people dying, potentially. Let me see. Conditions. Am I missing a booklet? I'm looking for the one that has the drugs. Huh? Too many things. Huh? Brain health, blood procedures. Tests, specialist, heart health. There should be one for drugs. Or is that a procedure? No, it shouldn't. Huh? What? Where? Did I drop one? Am I making one up? Were there 3 all along? Hey, go back. Thank you for that. Oh God, my Twitch is in Dutch, so I have to translate, and I'm shaking on the word. The subscription. Thank you. I'm missing a booklet, I think. That's so annoying. How am I suddenly missing something? Oh, it was hidden underneath. Woo, thanks for the bits, Eric. See, this worked now. Okay, I don't know what. Okay, I didn't touch anything. All right, back to it. So the drugs that we can give, labetalol. First line choice to treat extreme high blood pressure. Okay, so that one is the first line. The other one... LaborX is now following. Thank you for the follow. LaborX. LaborX? How are you doing, Kopak? Lisinopril. Sorry, I just got... Treats hypertension. Side effects include low blood pressure, dizziness, and a headache. Can increase blood potassium levels, particularly if the patient has a kidney disease. Okay, so I guess we shouldn't give her that, since she has a kidney disease. Lorazepam, used to treat anxiety as well as to stop a seizure while it's happening. And sodium nitro... lowers blood pressure, can increase brain pressure and worsen blood flow to heart during a myocardial infarction. So that's a heart attack. You're sick? Oh no. Well, maybe I can help. Maybe you don't want me to help, depending on what's going to happen with these 2 patients. Oh, you watched a week ago? Thank you. And thanks for rejoining. Or like a week ago. Anyway, so that's a heart attack. So symptoms of a heart attack. Oh, I was trying to look for a heart attack, but it's myocardial infarction. MI. Commonly known as heart attack. Symptoms include chest pain, shortness of breath, pain in one or both arms, heartburn, nausea or vomiting, sweating, lightheadedness, dizziness, and extreme fatigue. Oh my gosh! Thanks for the sub, Eric. Dizziness and extreme fatigue. Shouldn't there be... Is there no alert for this? There should be an alert. I'm sorry that's not happening. It's not an infarction. Okay, well, good. Although, maybe not, because I might know how to treat that now. An exception of family persevered and made... Okay. So, I don't know. So, but we don't think it's a heart attack, right? Because, like, the EKG was normal, but she does have high blood pressure, even though she's like, no, that's totally normal. But the cardiologist said, no, that's not normal. Get that down. Let's just use labetalol. Thank you. Labetalol. So that's DAH. And thanks for the sub as wow, y'all. Thank you. Thank you, Mom. Getting infarcted. That's what I like to do on stream. I like to encourage people to get a heart attack. That's what you can join me for. Take story card 37. Okay, so we're giving her meds to hopefully lower her blood pressure. Oh, there's a face and there's an arrow going down. You administered a labetalol via IV to accelerate how quickly it can bring down the senator's blood pressure. The senator's anxiety drops as well as her blood pressure. 126/73 normal. Her breathing slows and she says, I feel a lot better. She smiles, actually smiles at us, and you see her relaxed for the first time. Then she scowls. Okay, well, that didn't last long. Now, why the hell was my blood pressure so high? Hashtag say yes to heart attacks. Yeah, that's what we like to say here over on my Infartlek. Okay, well, she was happy for a little bit. Why was it so high? That's a good question. So we got story card 37. Probably anxiety. Do we? I mean, there's a lot of options here where I'm like, this might tell us something. Should we go back to our John Doe, see how he's doing? Because we fixed his face. Yeah, I think it's probably stress. Although this is very meta, but I feel like it's kind of like bad form for this game to send in a woman who's scared of having a heart attack, and then play it off as her just being stressed, because there's so much medical bias against women, and heart attacks often get missed. I feel like this game usually is, I don't want to say preachy, I don't think that's the right word, but this game tries to teach people things about the medical, field, and some biases too, I think. She does sound mean. Kobek, she's very mean. We don't like her, but we still have to treat her because that's why we're doctors. So I have a feeling there is something wrong with her, because otherwise I feel like the politics of it. But that's that's really meta. All right, so let's go back to John Doe for a second. So normally with this game you are treating one patient, but for the last case you're treating two at the same time. LaborX asked, how many board games do you own? Are you a collector? I have a friend who every time he talks about me to someone or introduces me or whatever, he's like, "Oh yeah, she collects board games," and I feel very called out on that. Um, I share a collection with my mom because she lives pretty close to me. My mom says a hoarder. I don't know exactly how many I own. It is, if you count our collection together, it is over like 5 to 600. Which you know, I mean, to be honest, my Calyx is pretty full, and I'm not really accepting new games at this moment. That's not entirely true, but I'm looking to call a lot of games. It's just the process of it is such a hassle. So I haven't been too successful getting. I'm trying to sell some games, but people are not buying them, even though I'm pricing them really low. Impressive is a word for it. Deranged could be another. I do play board games. I love board games, but yeah. Anyway, yes, we were gonna go back to John Doe, and I think Kopek says I'm a collector too, about 800 or so. Yeah, I see Kopek post a lot. We're both in a Discord together, and I feel like almost every week it's like mail's here. I'm like, dang, so many games. That's cool though. As long as you have the space, why not? We all need something to distract us, right? Kopek says, I'm going to throw some away, donate some to the library. Yes, do try to donate if you can. But it's hard, you know? It's really difficult to... yeah. I wish it was like a video game, you know, where you can just sell items to shops or whatever. I wish it happened like that, where I could just be like, take this board game and give me a fair price for it. Oh well. Should we test to see what drugs he took? Or... we should probably do something, like his back is really hurting him. Lumbar puncture. Do we really care what drugs he took? Because he's stable for now. Hold X to sell. Exactly, go back. Wish that was an option. Ugh. Although, if it was that easy to sell board games, maybe I would also be buying them easier. I don't know if that would really... Mom says, would a test tell us anything? Well, we can do an x-ray of his chest and abdomen. Abdomen, no, but we want to know his back. Because an MRI of the oh no, we can MRI his spine. Let's do that. Let's do an MRI for his spine. So it tells us to flip the card, and then we, since we're in this bracket, we get JUS. So looking that up. Chook chook. JUS. CFYE. Okay, well, CFYE. The MRI technicians asked, would you like to use gadolinium contrast? If yes, see something else. If no, see something else. Let me look that up. I don't know what that is. Where would that be? Tests? Maybe under this? MRI. Non-invasive, blah, 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 yeah, I know. I don't know what that is. Well, don't give me a term and then not explain it anywhere. What was it? Gadolinium. Gadolinium? Oh, here. Gadolinium, used in MRI contrast to improve image quality, can lead to kidney failure if creatinine, eGFR, is less than 30. I mean, or we'll use something else. Well, I mean, should we risk? I mean, I'm not going to risk that. I'm not just going to guess and be like, we'll see. I don't know his creatinine, so let's not use it to be safe. So CMVE. If you choose not to do the MRI at this time, you may choose a different action. We can also test first. Maybe that's better. How would we find that out? Creatinine. Substance in blood. We would have to do a Chem 7. Should we just do a Chem 7 first then? I guess. So Chem 7 is going to be HHA. CSX. Oh my gosh. All these abbreviations. CSX. If you have revealed... right? Right? HHA. I'm so lost suddenly. HHA. CCSX. CSX if you reveal the card with blood. Do we have blood? No. Oh, because we didn't test his blood. Well, we tried to, and then he, coded. Otherwise, CNTT. Going back and forth in a little book. NTT. Take story card 76. How is he doing? Okay. Oh, okay. That's some results. Those are some results. Okay, so his... Alright, so this is a creatine. They're... Oh, and his bun. His bun is high. He's clearly dehydrated. Yeah, that makes sense. His glucose is normal. Okay, so his eGFR is 28, which means we can't give him the other thing. So let's do an MRI now. So that's going to be just... and then they're going to ask us... FY... the gadolinium, and then we would say no, because if it was lower than 30, then we can't. Where was it? Oh my gosh. I'm just if it's lower than 30, yeah. Okay, so absolutely not. We're not doing that. So if no, CMVE. Could we give him fluids? Was that a thing? No. Yes, IV fluids. Yeah, we should have done that. That's like the number one thing you do. We'll give him fluids after, and then she's gonna get mad at us again. MVE. The MRI scan comes back. Without contrast, the amount of detail is less than ideal. From what you can see, there is no indication of a spinal epidural abscess. So no spinal... I'm feeling very exposed with my extremely poor handwriting. No spinal epidural, sorry. Epidural abscess. That's such a strange word, abscess. Okay. I guess we needed to know that for some reason or other. Let's give him some fluids, right? Let's be nice to him. All of these are... We're clearly favoring him. So that's C GW. Take story card 62. 62. 62. Okay. Oh, now we got the blood. To avoid the festering wound you find on his right arm, you insert an IV catheter into his left arm. As you do, you look carefully for any track marks or bruising that would indicate he has been taking drugs via a needle. His arms are clear. Either he hasn't been using drugs for very long, or he isn't taking them intravenously. You attach the fluid bag. As it drains, you can see the John Doe perk up. He was clearly dehydrated. Yeah, he was. Okay, that means that it is time for an update because it is now 4 p.m. and we're going to read hers first. Mass. M-A-S. Take story card 25. As you enter the room, you see Senator Perez put a white and orange pill in her mouth and follow it with water. Just the person I wanted to see, she says. I've been here for over 4 hours. If our government worked like your hospital, well, we'd never get anything done. When you ask her what the pill is, she says, It's one of my prescriptions. Look. When will I be able to get out of here? You don't know? Great. She pulls out her phone and dials. She waits, then hangs up. And none of my family is picking up. This is just one shit day. She rubs her temples and says, God, this headache. Then she looks up. Well, I hope you at least have good news for me. Should we have given her something? Oops, sorry. Okay, and now for him, since it's HLN. If you have revealed a card with a pill bottle, I don't think we did. No. Otherwise, see BCK. Is that when we find out what he took? Bye, lady, exactly. I remain. There's probably something wrong with her, but... not forgetting again. I'm a bit loopy today. BCK. BCK. Take story card 89. There's so many cards. John Doe. The John Doe is looking pale. As you check his vitals, he says, I'm not a drug addict. I'm just in a lot of pain. You have no idea how hard my life is. No idea. He appears to be having trouble keeping his eyes open. He rubs at his arm under the blanket. My mom expects so much from me. It's unfair. She's a perfectionist who's used to everyone saying yes to her. Everyone but me. He's fading fast. Can I have some water? There's something... Oops. Can I have some water? There's something going on with him that is not related to the drugs in his system. You need to figure out what it is. Quickly. Well, I'm trying to figure out what it is quickly. Alright. Well, she's, meanwhile, she's also not doing great, I don't think. Okay, so... I know there's something going on with him. We know he was dehydrated. We tried to MRI his spine, but we couldn't. Should we... What? Okay, so we've got 2 experts we can consult. We can get a toxicologist or a nephrologist. And I don't know what that last one is. A nephrologist is a kidney specialist. I know, no pressure. Kidney specialist. So we can do a blood test. So a lumbar puncture, but we wouldn't just do that. To test meningitis, leukemia, or cancer of the spine or brain, or other illnesses, a needle is inserted into the space in the lower back between the 2 lumbar bones to remove a sample. So that's very invasive, so we're not just going to do that without any cause. Um, no, I'm just going. I'm not saying we have to do this. I'm going over every option we have. That's why I mentioned it. But I don't think we should do a lumbar puncture. We can do a CBC. That's a complete blood count test to uncover conditions such as anemia, so blood loss, infection, leukemia. We did a Chem7. We didn't do the blood test drug panel, but I guess the game just told us that that's not really that important right now, I don't think. I don't know what the blood test synthetic opioids is. I'm guessing so, and the books don't tell us. Oh, my mom says for the test for the kidney failure. I don't know. Well, his creatine was low. No, it was high. It was below 30, but it said it was high. So there could be something wrong. I think that can mean there's something wrong with the kidneys. We checked his spine. And I guess your kidneys, if your kidneys hurt, you usually also have pain in your back, right? So maybe there's something there. But I don't know how we would test for that. Maybe should we just get the expert in? Let's just ask the expert. Nephrologist. Z-A-M. Zum. Asking an expert is good. Yeah, especially because I don't know shit. If you've revealed a card with tests, which we have, see WNF. Okay, WNF. The nephrologist says, I see you've run a Chem7 lab. These high numbers indicate a kidney issue. The most likely cause for these results is dehydration. Giving him IV fluid should clear things up. I did give him IV fluid, sorry. And don't tell me I should do something that I already did. The expert is dumb. Yeah, exactly. Give fluids. I did. And he's fine. He's perked up. Maybe the update just sucks. I don't know. WNF. The most likely cause. Yeah, okay. I mean, there's still something wrong with him. Should we test his blood then? Because I don't really know what else we could do. I mean, we can still do an x-ray of the chest and abdomen, I guess. So either we can test his blood or do the chest and abdomen x-ray. What should we do? What would an x-ray show? That's a good question. I guess it'll show the chest and abdomen, duh. A type of radiation creates pictures of the inside of the body. They show the body in different shades of black and white. Yeah, no, but I mean, yeah. I'm assuming it'll show something to do with the kidneys. I think if we suspect that there's something wrong with the kidneys, then we should do an x-ray. If we think there's maybe something else, we should probably do a blood test. Because I think the blood test, so the CBC blood test, that's like a complete blood count test. So we would know about anemia or other things. X-ray? Okay. Let's do the X-ray, chest, and abdomen. And we're going to flip the card over again, and now we're in the third column. That is RJ. Okay, we should go back to this lady as well soon. RJK. RJK CMAZ. The X-ray shows nothing of note. Neither his spine nor his ribs are broken or cracked. There doesn't seem to be any evidence of a kidney stone either. Alright, it's not his kidney. We need to check his blood. I'm saying we're doing a blood test right now, and then we'll get back to the lady. Thank you, Kopak. Thanks for joining too. Hopefully I have good news in the future about these people. Sleep well. Yeah, so blood test. CBC. So that is U, Q, U. Where is it? U, Q, U. C, P, C, H. PCH. His white blood count is elevated. He has leukemia. Okay. White blood cell count alleviated. Well, that is not good. Would that be under heart health? There's a blood thing. There's a specialty about blood. So, white blood cells help the body fight infection and disease. A high WBC usually indicates the body is fighting an infection. A low one increases the risk of getting an infection. So he probably has an infection, but we don't know what. We did almost every test. So I guess I'll look into the drugs we can give him. Maybe that'll give us some... I lost the fucking thing. Okay. So we can give him acetaminophen. First line treatment for mild to moderate pain, taking more than recommended, or combining with alcohol risk kidney damage and liver failure. Amoxicillin treats certain bacterial infections and infected cuts. Will not work on viral infections. Okay, so this works against infections, but only bacterial, not viral. Ciprofloxacin. That's an antibiotic. Treats certain bacterial infections. Can cause adverse side effects, including diarrhea, vomiting, and nausea. So something else is preferred, which is not listed. Avoid if patient has ever had seizures, epilepsy, cerebral something, stroke, or kidney disease. Okay. And then we've got codeine. That's a prescription opioid, which I don't think we should give him. Have a feeling. We can also just... we can ask him what drugs he took. And we can ask to see his arm, by the way. Maybe his arm has like a cut that's infected. but research his arm is not part of our options. Oops. Uh-oh. This just fell. We did almost every test on him. Because I don't want to do a lumbar puncture without reason. And I don't care about the drugs that much. I think we should ask him. Should we? So, okay. When we ask him things, we can ask him his name, how we can reach his parents. He's not going to answer that, I don't think. What drugs did you take? Then one question is, what happened? Why are you bruised? May I see your arm? Those are actually 3 questions, but you know. And then 5 is, how can I help? What do you need? I do like 5. I like helping. I like asking him what he thinks he needs. I want to ask 4. That's definitely one that I want to ask, which is GMW. I'm wondering between what drugs did you take, even though we're like, the drugs aren't that important. It might be important when we give him whatever we want to give him to know what he's already taken. But I do really like asking him, what do you think you need, or how can I help? I think that's just good. You know. So what should we ask of those 2? What drugs did he take, or how can I help? How we can help? Okay. That is ZGA. Okay, starting with GMW. Take story card 55. Okay. I like getting the story cards, and I'm also scared of getting the story cards. John Doe says, I was stupid. I took a walk in a bad part of town. I got jumped and roughed up. Had my wallet stolen, but they didn't find my phone. You ask, who gave you Narcan? I don't know. I was with someone. Maybe he did. They really worked me over. He touches his face and grimaces. Then he rubs his arm and back. You say, show me your arm. He pulls up his sleeve to reveal a festering scab. It looks infected. Sorry, I wasn't keeping it in the camera. See? Okay. Why is examine the scab not an option? And the other thing is ZGA. Takes story card 56. So, how can we help? What do you need? That's what we're asking him. Ooh, we got 2 of these. John Doe says, are you for real? You say, you've obviously been through a lot. It sounds like things might not be so good at home. Says, yeah, it sucks. You wait for him to finish, but he doesn't. You don't have to do all this on your own. There are people who can help you. That's a nice offer, but when my mom finds out, she doesn't have to find out. The John Doe hesitates. Then he says, I'll think about it. Okay, but we got plus plus. That has to be good. Plus plus good. He trusts us, maybe. Alright. Infested scab. How do we... Okay, so that means... now I forgot all these dang drugs again. This is a painkiller. We've got an antibiotic for bacterial infections and infected cuts. Oh, I mean, that's this. We have to give him a We haven't interacted with this lady at all. She's, I swear to God, at the end she's gonna die because we ignored her. Virus? No, it's not a virus. Ow, I just hurt my hand. Okay, so we are gonna give him, again, gosh, this, amoxicillin. Amoxicillin on him. And that is going to be WFV. WFV, take story card 79. Oh, we got the pill bottle. There is no immediate effect. It will take some time for the medicine to take effect. Okay. But I think that with that, we can leave. I mean, we're going to get updates right now because we're at the end. But I think that that's probably good. So we're going to get an update from her. She's going to get real upset. TAV. Forgot how the alphabet works. Take story card 28, then take story card 10. That's not good. Getting 2. 28 and 10. 28. Before you can check on Senator Perez, the hospital director pulls you aside. So what's happening with the senator? She's given me quite an earful about how substandard her care has been. You start to explain, but the director holds up her hand. I know we're understaffed today. It's just that the senator knows several of her trustees and has made it perfectly clear that she's going to talk to them. The director sighs. Look, I've got your back. Just do your best not to piss her off any further. From inside the room, you can see Senator Perez smirk at you as she takes an orange and white pill. She's taken all these pills. She's taken a lot of pills. When I look at her medication, I don't think that's quite... We can ask her what drug she's taking, by the way. Okay, so the next card... Oh, she's mad. Look, she's mad again. Senator Perez puts her hand to her forehead. This headache has gotten out of control. She stops talking and starts to look around the room as if she's lost. You notice her right eyelid begin to droop. Then she collapses to the floor, unconscious but still breathing. Take status card 4, collapsed. Yeah, I mean, we knew that was probably coming, right? Well, not necessarily collapse, but we were giving a lot of attention to the John Doe. So, status 4 collapsed. We can no longer interview her because that's not an option. We can do a ton of tests. I have to do his update too, but CPR, brain surgery. Okay, well, we've got some stuff over here. Eric says, gotta find out which drugs to Harway. Yeah. But we have his update first. So his update is MSE. If you have revealed a card with the bottle, which we have, then see YGY. YGY. The John Doe is still in a great deal of pain. Oh, we have to give him pain meds. He keeps holding his back. Will you let me contact your mother? You ask. He shakes his head. What about your father? He laughs. My dad'll just tell my mom. He crosses his arms. I've got to solve this myself. He scowls and says, Really, I'm not a drug addict. I don't use needles. Then he stops talking, his eyes squeezed tight as he breathes through the pain. Okay, well, we can... Do we believe he's not an addict? Mom says we had this before with another patient. Yeah. I mean, there's only so much time. Things are gonna happen. We should probably give him something for the pain. I mean, she collapsed, but that just flew off. He was mugged, maybe kicked him in the back. Maybe, bruised kidneys, maybe. I mean... So we can give him we should probably just give that to him. I don't think we don't know if he drank any alcohol. But I don't want to give him codeine. I don't want to give him opioids. Right? I'm not an addict. I don't use needles as a pretty big red flag, though. So we have two options for pain medication. We can either give him opioids, or we can give him the acetaminophen, which is the first line treatment for mild to moderate pain. Taking more than recommended or combining with alcohol risks kidney damage and liver failure. I don't think he drank alcohol, though we don't know. So which should we do? Eric says he is or wasn't opiates. Yeah. Would it be weird for him to be in this pain if he's on opiates? I don't know. Alright, I'll give him... We're running out of time. We have to treat this other lady. Acetaminophen. UKC. Take story card 77. Oh, got a hammer. Another thingy. The John Doe has taken a medication but still looks somewhat uncomfortable. He says, can't you give me something stronger? You advise him that this is what you can safely give him at this time. He moans and throws himself back on the bed. If you have revealed a card with this, in either John's or the Senator's card, take story card 68. We have not. I'm fairly certain, because that looks brand new to me. No, we haven't. Alright, well, he could also just be trying to get more drugs. We're going back to her. We have 1, 2, 3, 4 actions left before the end of her shift. So she's collapsed. So we can do, again, we can take a Chem 7. And a Chem 7 that shows us all sorts of things about the blood. We can do a blood test, troponin, that measures troponin levels in blood. That might be a sign of a heart attack. We can do a brain CT angiogram. that shows blood flow through arteries or veins that can detect an aneurysm. She was having a headache. We can do an EKG again. We can do an MRI of the abdomen or chest. A toxicology screen, which would probably tell us what. This checks for up to 30 substances in a patient's urine, including prescription medicines, natural health products, alcohol, and illegal drugs. Or we can do an ultrasound on her kidneys. Yeah, we need to know about the pills she's taken. Should we do a toxicology screen? I mean, okay. She came in and she's complaining that she's having a heart attack, but her EKG was normal. And now she's collapsed. But we're not in a medical emergency. Do we want to see if she's having a heart attack? Even though I feel like the EKG... I'm going towards toxicology, right? I just don't think... So we're in the last bracket. Vum. So... toxicology. Well, that can change. I'm just saying, I'm thinking because the EKG was normal, that's why I'm thinking it's not a heart attack. But I don't know if that can happen. Okay, so VUM. I'm getting hungry. VUM CTVY. The drug panel comes back positive for amphetamine, which we know. If you would like to ask Senator Perez about why she has amphetamine in her system, choose amphetamine as your next action and see ZA. She's collapsed. We can't ask her. Here's the thing. We know why, and that's one of her medications. It says can test positive for amphetamines. So I don't think we should do that. Yeah, so she's getting her ADHD medication can cause a positive test result for amphetamine on a drug test. Address the brain. You wanna... So she has a kidney disease, but she says it's under control and she's not worried about it? Or do we... She was complaining about her head. That's true. Which can, of course, be a symptom of a heart attack. Or even an aneurysm. That's a funny thing about headaches. It can be anything. All right. Sure, brain CT. We can also ask a neurologist, but... Brain CT angiogram. Why? We're just throwing things at the wall right now because we're like, I don't know. YVL. Take story card 27. Well, at least we're getting a new story card. The brain CT angiogram comes back and it doesn't look good. Senator Perez has a serious aneurysm and it is already ruptured. Oh, snap. Ruptured aneurysm. Let me hold up. Let me look up what that means. An aneurysm is an abnormal bulge in a blood vessel that builds up over time. A rupture can cause internal bleeding and often leads to death. Symptoms include lightheadedness, confusion, extreme headaches, fatigue, abdominal pain, rapid heart rate. High blood pressure increases the chances of developing an aneurysm and increases the chances of aneurysm rupture. Diagnose with a CT scan, MRI, or angiogram. Treat with surgery to repair the aneurysm. See stroke if an aneurysm in the brain ruptures. Okay, see stroke. I know, this is an emergency operation for sure. Stroke, a sudden life-threatening brain event that happens when blood supply to part of the brain is disrupted. An ischemic stroke occurs when blood supply to the brain is blocked, usually by a blood clot. A hemorrhagic stroke occurs when a blood vessel in the brain ruptures. Symptoms include sudden lack of balance, weakness in one side of the face, arm and or leg, confusion, trouble speaking or understanding speech, dizziness, or severe headache with no known cause. Treat immediately to reduce brain damage and other complications. Diagnose with a brain CT scan or MRI. Treat brain surgery may be required. Beta blockers can control heart rate. Treat a hemorrhagic stroke with medication and surgery. If patient is taking blood thinners, stop them immediately. Okay, so we're doing brain surgery. That's going to be our next. RZL. If you have revealed a card with this symbol, CSLL. Oh, I will. Take story card 29. Oh man, are we going to be able to do it? As you prep for surgery, you feel like you've let Senator Perez down. She had all the signs of an aneurysm. If only you'd recognized them before it ruptured. Wow, we're getting shamed here. You can't help but think about how 2/3 of patients who have a rupture experience permanent brain damage. Now all you can do is your best to minimize the impact on the rest of her life. Take story card 26. We just got shamed by this game. Ew. The surgery proceeds smoothly. You cut into the senator's scalp to expose where the aneurysm is located. Then you place a metal clip over the weak area of the brain blood vessel where the aneurysm is. When another nurse bursts into the surgery room, the nurse says, "It's the young man. He's bent over and screaming in pain. No one else is available to ask. Should I give him ibuprofen, oxycodone, or Vicodin?" Take story card 13. None of the... Well, not none, but... We definitely should not give him oxycodone or Vicodin. Oh, switch. Start a timer. Okay, I'm not going to start that until we have read these results. You have 30 seconds to choose a response. What do you tell the nurse? Give him ibuprofen, oxycodone, Vicodin, or I'm in the middle of an operation. I'll see him as soon as I'm done. Okay, I'll start a timer. What should we tell the nurse? I'm going to give a little more because I know there's a delay. Oh man. Ibu. All right. He's already on another medication as well. Ibuprofen. Okay. To continue with the surgery, take story card 30. The surgery is done in a few minutes. You have the assistant complete the sutures. As you clean up, you hope you did enough to help the senator return to living a normal life. Look through all the cards you've revealed. Find all cards with her face. If you have more angry than happy, take story card 32. Otherwise, take story card 31. Uh-oh. 1 angry. 1 happy. 1 angry. 1 happy. We have an equal amount. So we don't have more of the angry. So I think so we should take story card 31. Congratulations! Senator Carmen Perez will survive the night. The surgery was a success. Despite the tremendous stress Senator Perez puts herself and those around her under, she has pulled through. Take status card 5, recovering, and take story card 33. There's also like something over here. I don't know what that is. Status card 5. So where is her set? Here. No longer collapsed. She is recovering. We can interview her again. And story card 33. You still have the John Doe to take care of. Hold off on filling out your final report for Senator Perez. Do not read Senator's epilogue yet. You hurry to John Doe's room to see how he is doing. Take status card 8, in extreme pain. If you told the nurse to give John Doe pain medication during the surgery, CHLA. Oh. Any. Doesn't even matter which one. Maybe. Look up the result code for the medication you recommended from the John Doe's current status card. This is a free action and does not use an action slot. Okay, so we said ibuprofen, which is FSK. Take story card 77. Oops. Where do I have story card 77? That's this one. Okay, that's one we already had. He's taken a medication, but still looks somewhat, uncomfortable. Now it's asking if we have revealed a card with this, take card 68. So I guess let's look at 68. It feels weird that we're given a card that we already had, and the senator's fine, so I'm about to... Okay, whatever. The John Doe is curled up in bed, breathing heavily, perhaps even crying. Nurse Judy takes you into the hall and says, "I'm concerned about his well-being." She looks back into the room as the John Doe groans. "I've stationed another nurse to monitor him regularly in case he has another episode. Look for cards with these symbols. Before each action, check if you have revealed 4 or more of them. If you have, take story card 92. I think we have. Hammer, that's 1. Pill, that's 2. Blood, that's 3. Suture, that's 4. Yeah, so we have revealed 4 of them. So we have to take story card 92 right now. The nurse monitoring John Doe calls you back to room 202. His breathing is labored and his face is locked in a constant grimace of pain, despite what you've already done for him. This has been a difficult day for the John Doe. He is in terrible shape. You're not sure how he keeps going. He's also been through a lot of stress over the past hours. Suddenly he arches his back and cries out. Look through all the cards you've revealed, including the senator's cards. Find all cards with plus and a heart. If you have more heart than plus, take a story card. Okay. Plus. Plus plus. 3. 4 plus. 5 plus. We've got 5 pluses and only one of these. 2 of these, sorry. So we have more pluses. So that is story card 80. This young man must have a strong will to live. However, it's still not clear whether he's going to survive the night. Something is causing him pain and it isn't clear what it is. What do you mean? We know it's his arm. Right? I'm so confused. Take story card 82 and then 61. 82. 61. I don't know if y'all could hear that, but my stomach is growling. Oh. The other arrow. The John Doe grits his teeth and pushes through the pain, which seems to let up after a few minutes. He's stable for now. You may continue to work with either patient when you are ready to fill out your final report, but before you begin, see LTP. Do not read the epilogue yet. When you're ready, you can complete your final report for both Senator Perez and John Doe. So what was the cause of their symptoms? What treatments did each of them require? And what recommendations do you have? I'm not ready for that. Also, I feel like we're going to have to put... Oh my god. It says take card 67. Well, it didn't instruct us to do anything. Okay. Apparently we don't know what's wrong with him. So... we have one more action before our shift is over, so I kind of want to finish out our shift since we apparently don't know what to do here. Spoiler though, there's no more status cards for him, which is interesting. He's a mystery coal house, Mom says. No, warehouse, but nicer. We did every single test on him. Would we still read her? Yeah, we would. I don't know what to do. I don't think we should just do a lumbar puncture. So either we give him more pain meds, but he is an addict, or we suspect that he's an addict. We don't know that. He came in with an overdose. That doesn't necessarily mean someone's addicted. And he seems to be struggling in life. Why can't I find what a blood test synthetic opioids means? Oh, here, sorry. Checks blood for presence of synthetic opioid, including fentanyl. We didn't do it. No, we started a drug test, but then he collapsed, so we never actually did it. We would test for all sorts of street drugs. There's a separate test required to screen for synthetic opioids. But apparently we still don't know the cause of it. I mean, I don't know if that's the only thing remaining. We don't know what's wrong with him. No, he's in a lot of pain, even though he's on several. I'm noticing that I'm hungry and my brain is starting to go. He's on several painkillers, and he's still in a very, a lot of pain. We did an MRI, we did an X-ray. The only thing we didn't do was a lumbar puncture. But that feels... It's the test if there's... it's to detect meningitis, leukemia, cancer of the spine or brain, and other illnesses. But that's pretty invasive for something that... Eric says, was it confirmed he had drugs in his system? No. But he overdosed, I think, right? Oh my god, did he not take any drugs? He said, well, he made a comment. He said something like, I'm not an addict because I don't use needles. I wonder when I'm supposed to take card 67. Is that right before the end? Someone gave him Narcon. You can snort drugs, yeah. You can also just like take them orally. there's a But I don't know if, like, finding out what drugs he took, I don't know if that'll help him, help find out what's wrong with him. I feel like we don't have any reason to do a lumbar puncture. That's a really invasive procedure. You don't just do that with someone. I feel like we don't have any reason to... Okay, going back to his cards. So he had a code blue, and then we gave him thingy. And then CPR and we gave him the medication. We sutured his face. We did do an MRI. Yeah, we did that. And there was no spinal epidural abscess. Yeah, his back really hurts. Then we've got Senator. We fixed the lacerations. And then we tested his blood, and then we found out that he was dehydrated, so we gave him fluids. His arms are clear. Either he hasn't been using drugs for very long, or he isn't taking them intravenously. You attach the fluid bag. As it drains, you can see him perk up. He was looking pale. As you check his vitals, he says, "I'm not a drug addict. I'm just in a lot of pain. You have no idea how hard my life is." Okay, so like he is in a lot of pain, and that's why he's taking pain medication. And he has some, struggles at home. And he has a scab that's infected. What if he's just lying? I don't think he is. So we don't know why he's in so much pain. I mean, the lumbar puncture is the only thing that we can do that's left. Because we ruled out everything else. His MRI was fine. So we did an X-ray, and that was normal. There was nothing to see there. We did an MRI, and that said there was no spinal epidural abscess. So maybe that is the only thing we have left, is to see if he has something else. So I guess I will choose that. And it says to do TDZ. See story card 72. Let me write that down, by the way. So lumbar puncture TDZ. Story card 72. Okay, not happy. The John Doe is not happy about your proposal to perform a lumbar puncture, but he consents. You have him lie on his stomach and you insert a needle into his back. You carefully draw a sample of fluid from his spinal cord and send it for analysis. Soon the results are available. His fluid is normal. You share the news with him. He says, "Why did you make me do that? It was painful and uncomfortable and pointless." You explain it rules out spinal or brain cancer, but he doesn't seem to be listening. Okay. So now we get an update. So ABR. You can't believe it's the end of your shift. Finally, Senator Perez will be someone else's problem. And for him, DHR. If you have revealed a card with an arrow, then see EFA. Yes, we have. EFA. It's the end of your shift. If you would like to continue with overtime actions, you may do so. Take story card 61 if you haven't already. I think we have 61. Yeah. Do we just put these arrows... When do we put these arrows together? Because it says take card 67. I'm just gonna take that card. Maybe we're cheating? Nurse Judy is sitting with the John Doe and finally convinced him to call his mother. As he makes the call, you hear a jingling ringtone down the hall. No answer. Oh my god. Sometimes she's busy. She's told me to call twice. He calls again, and the jingling sounds again. That's the ringtone my mom uses for me. He rolls out of bed. Before you can stop him, he's down the hall. Mom? He says. Mom? I can't believe I didn't see this coming. Did y'all see this coming? He's her son. Senator Perez says, It's about time you... Wait, what are you doing here, Joe? And I thought I told you not to dye your hair. He says, Mom, are you okay? She says, No, I'm not, but hopefully I will be. Suddenly he bends over in pain. She says, What's wrong with him? Grimacing, he tells her everything. You watch as the senator's face drops in horror as he talks. When he's done, she says, You're the drug addict? She gets out of bed and puts her arm around him, and for the first time, you see her let go of being the senator so she can be a mother hugging her son. Take story card 84. Eric says, What's funny is I thought they came in together at the start, but when she didn't know there was another patient, I was like, no, guess they aren't related. I mean, yeah. We should have taken that card earlier then, I think. I think it's a little unclear because I'm like, I'll do something when the game tells me to. Anyway. Senator Perez is the John Doe's mother. You feel a mix of emotions at discovering this. Dealing with him as a John Doe created a lot of difficulties for you in diagnosing and treating his condition. It was like working in the dark. Who knows what his medical records might have revealed, if only. You have an intuition that you're missing something. If you have an insight, write it down on the patient form. When you're ready, take card 85. Okay, so that means that we know some of his medical history. We know that there's... she had an aneurysm, ADHD, she has polycystic kidney disease. We know that there's a kidney disease. Married, lives with a husband, has 2 adult children, works as a senator, never drinks alcohol. And high blood pressure is in the family. Do we have an insight? I guess an aneurysm is now in the family. Like high blood pressure, but his vitals were normal. Any insights, chat? Because I'm about to grab card 85. Kidney stones? I'm pretty sure, unless I'm getting them confused, but there was nothing that indicated kidney stones or anything. So, because we did all the tests. Woman. Carmen Perez is Joe's mother. You recall that her medical chart says that she has polycystic kidney disease. This is a dominant genetic disease, meaning there's a 50% chance that Joe has inherited it. Yeah, if he does, such cysts could be the source of his pain. A kidney ultrasound would answer that question immediately. Yeah, but that's not an option. If you've revealed a card with this symbol, we haven't, take story card 65. Otherwise, take card 58. I don't know. You waste no time sending Joe for a renal ultrasound. The results are conclusive. He has several large cysts on his kidney. No wonder he's in such pain. The nephrologist advises immediate surgery and rushes off to prep to perform the operation herself. It looks like Joe will survive the night. Take story card 65 if you haven't already. We have not. This is a long chain of events. I feel like how could we did all the his kidneys looked fine. No, anyway. It's time to complete your final report for both Senator Perez and John Doe. After you have filled out your final report, read both epilogues. Start with the senators. I mean, I'm not going to write everything down, but I'll flip it over. So, what caused Senator Perez's symptoms? She was having an aneurysm, and that was causing all of her symptoms, and it ruptured while she was in the hospital. John Doe started out having overdosed, so we had to cure that. But his overall symptoms is because he has the same polycystic kidney disease that his mother has, and he uses drugs to cope with that pain. I think that's that. Then what treatments what treatments did we provide to treat Senator Perez? Well, we did a lot. We did an EKG, which was normal. We gave her some labetalol, which lowered her blood pressure. And that's basically it, actually. We got a toxology report for her. Was that all? We didn't treat her with anything. I guess everything else came after. And for him, we've also fixed up his face. We gave him fluids. We did X-ray chest, blood test. We gave him the pain medication. We also gave him the thing that helps against his infection, which he has on his arm, infected scab. We gave him pain medication twice, ibuprofen and acetaminophen or whatever. And we did brain surgery. And unfortunately, we also did a lumbar puncture for no reason at all. Recommendations in their lifestyle change. My recommendation is that Senator Perez grows some empathy and goes to therapy for her issues where she hates other people and seems like a horrible person. I also recommend therapy for both of them and maybe including the dad. They should get some family therapy. I think all of these people in all of these cases need therapy. I think everyone needs therapy. John Doe needs some treatment with his potential drug problem, and he needs some help managing his disease that he now has, so he needs medication for that as well. He also needs to his sutures might need to come out after about a week, unless they dissolve on their own, and he needs to check his infected scab out. Like that needs to be checked, monitored. And she needs to be careful, I think. She needs to take her high blood pressure seriously and, whatever comes next after an aneurysm, that has to be monitored. I think that's it. Okie dokie. Epilogue. But we had to read something else, right? When you are ready to fill out your final report, but before we begin, oops, see LTP. I guess we should have read LTP before we filled it out. Oh, LTP says find the 2 cards with the pointies. Yeah, okay. So now we read the epilogue. We did it, chat, we made it. Warning, don't read it before the game tells you. Okay. Caring for the senator has been challenging, to say. the least. She's confident she has a heart issue, while at the same time she believes there's nothing wrong with her blood pressure. A simple EKG or troponin lab will show that she's in no danger of having a heart attack. Her blood pressure, however, is something to be concerned about. If you run a Chem7 lab, you'll find that her creatine and potassium levels are elevated. You might believe her polycystic kidney disease is at fault. A kidney ultrasound will show that she does have cysts, but they are not an immediate concern. Several of the medications she's taken can cause headaches or make breathing difficult. If you run a drug panel on the senator, you'll find that she has amphetamine in her system. However, this shouldn't be surprising because she takes lisdexamfetamine for her ADHD. In fact, she takes quite a bit more lisdexamfetamine than she has been prescribed, as can be seen by the orange and white pills she keeps taking, right? You could discover what these pills are by asking her a question about her prescriptions, so it's not surprising she's having an anxiety or panic attack. You can calm her down with lorazepam, however, you still have to deal with her high blood pressure that the lisdexamfetamine and the anxiety have caused. Labetalol is the first choice treatment for extreme high blood pressure. If you give her lisinopril instead, it will increase her already high potassium levels, causing her to stop breathing. CPR would be necessary to save her life, and if you give her sodium nitroprusside, while it would lower her overall blood pressure, it could increase her brain blood pressure. Blah, 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 blah. And this would lead to disaster. Increasing brain pressure would cause her brain aneurysm to burst. It can also burst if you haven't discovered the aneurysm by 6 p.m. An angiogram brain CT can identify the aneurysm before it bursts. If the aneurysm has already burst, you'd still have to run an angiogram to figure out where you need to operate. Brain surgery will hopefully help Senator Perez survive the night, but saving the senator involves more than just stopping the blood flow through the aneurysm. Too much stress, and the senator practically lives on stress, could aggravate the aneurysm. Her survival depends on how well you help her manage her anxiety and whether your actions make her more angry or help to calm her down. Sometimes bedside manner can make all the difference. So, to score, we get 40 points if she survived, which she did. 10 points if we verify that she's not having a heart attack, which we did. 10 points if we identify that lisdexamfetamine is the cause of her panic attack. No, we didn't. 5 points if we verify that her kidneys are not a cause of her symptoms. Did we verify that? I don't think so. I don't think we did. No. Plus 10 points if we lower her blood pressure, which we did. Minus 5 points if we gave her the wrong medication, which we didn't. 20 points if we identify that she has a brain aneurysm. I mean, we did, but minus 15 points if it ruptures. In addition, she has a 2/3 chance of having permanent brain damage. Yeah, not my finest. Plus 5 points if we recommend that she should get some help with her stress. I mean, I said therapy. Does that count? 5 points if you recommend that she should get drug addiction education and counseling for her abuse of lisdexamfetamine. She says, but I'm not an addict. This is a prescription drug. Okay. We didn't say it because of that. Minus 5 points if you take longer than 30 seconds to respond to the nurse. No. Okay, so we have 65 points. Maybe 70 if we count one of these. Well, now for our John Doe, also called Joe. This is a mess on my... This is such a mess. My gosh. All right. If you have revealed a card with thingy, but not a card with... Then read LTP first. No. Treating someone who doesn't want to be treated is hard. Treating someone who is also without an identity is even harder, as not knowing your patient's past medical history makes it more difficult to diagnose and treat symptoms. Given the lack of information you have, your safest course is to assume the worst. Because Narcan can wear off before the other drugs in his system, the John Doe might have a dangerous rebound overdose. Someone needs to monitor him constantly to respond if this happens. That's the first thing we should have done. One of the actions was monitor, and we didn't. And a rebound overdose does occur while you're dealing with one of the many distractions typical of a hospital setting. As the rebound overdose occurs almost immediately, it must be over an hour since he received a dose of Narcan. He stops breathing during the rebound overdose, so CPR must be administered before giving naloxone, that's a generic name for Narcan, to counteract the overdose. During the rebound overdose, the John Doe tears open his head lacerations, so that needs to be sutured. He also has a festering scab on his arm, as you can discover. Antibiotics are required to treat the infection and prevent him from going into sepsis. Running a standard drug panel would reveal that John Doe has taken either heroin or morphine. I was wondering if we were going to find out. However, a synthetic opioid drug panel would show he also has fentanyl in his system. Oh no. Perhaps unintentionally if it were mixed with the heroin or morphine. It's a fentanyl that's causing the rebound overdose. A Chem 7 lab would show high creatine and bun levels, indicating a potential kidney injury. The nephrologist suggests that dehydration is likely the cause of his kidney injury. If you give him fluids, his creatine and bun get better. That's important if you want to use gadolinium contrast dye for a spinal MRI. So that's why we could have done we could have checked his blood again to see if that changed so that we could have done the MRI with the... Okay, because I was wondering, like, what did we do wrong or what did we miss? That's the part we missed. We couldn't do the full MRI because of his labs. But apparently the fluids would have helped. Okay. There are several probable sources of back pain. See research. A spinal MRI would rule out a spinal epidural abscess, typical of drug users who use contaminated needles. However, if he's dehydrated, that could trigger an adverse kidney reaction to the MRI and require dialysis. A chest x-ray verifies he doesn't have a major bone fracture or kidney stone. A lumbar puncture rules out spinal or brain cancer as the cause of his back pain. So what's the source? While you search for the cause, you can give the John Doe something to ease his pain. Unfortunately, given that he has overdosed on opioids, giving him an opioid-based medication like codeine, oxycodone, or Vicodin will trigger another rebound overdose and require another dose of naloxone to counteract this. Even ibuprofen should be avoided, as it might cause further trouble with his kidneys. The best medication you can offer is acetaminophen, which we have given him. Ultimately, the John Doe survival depends on how well you've cared for him. Too many mistakes and even his young body will give out. Well, they both survived. The final discovery is the John Doe's identity. Senator Perez is his mother. With this important piece of information, you can see that there's a 50% chance he has polycystic kidney disease. Verifying this with a kidney ultrasound confirms the source of his back pain. If only you had his medical history to start with. And this pain is likely the reason he's been taking heroin or morphine. So, now we're going to score. We get 40 points if he survives, which he does. 5 points if we immediately monitor John Doe. We didn't. 5 points if we administer CPR immediately. We did. 5 points if we gave him Naxoclone immediately. We did. Yeah. $10 points if we suture his face. We did. 10 points if we gave him antibiotics to treat his arm. We did. -5 if we gave him the wrong medication. No. It says -5 points if you give him ciprofloxacin, which you should avoid giving to someone with kidney disease. Unfair that you didn't know he had a kidney condition? Tell that to John Doe when his kidney fails. This game is sassy. -10 points if he goes into sepsis because you didn't provide antibiotics soon enough. No. +10 points if we gave him fluids. We did. -5 points if you respond to the gunlet emergency with something other than dialysis. No, we didn't. 10 points if we gave him medication to ease his pain. We did. Minus 10 points if we gave him an opioid-based painkiller. So we didn't. Minus 5 points if we gave him an NSAID like ibuprofen, which we did. As it can worsen his kidney damage if he has any, which indeed he does. Plus 10 points if you have the insight that since his mother has the disease, he has a 50% chance of that as well. I feel like we did, because I did mention it, but I didn't know, because I don't think it says that 50% blah, 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 blah. See genetics. Oh, I didn't look into that at all. I thought I read it. That's wild that I didn't read this. Dominant genetic disorder in which cysts are formed in the kidney. Patient may develop blood in urine. Okay, fine, and I won't give myself the points. Although I feel like I mentioned the fact that she had a kidney disease thing. 5 points if you recommend drug and or pain management counseling. I did. Okay, that means that we have 90 points for him. I think that that's pretty good. Well, that was a long stream. Certainly longer than usual for these. Mother and son both survived. She might have some trouble, though she seemed fine when she talked to her son. So those are the last cases. I guess that the reason why this is expert is because you're dealing with two things. That's what I'm assuming. I did feel like they were definitely more challenging. Again, we, I didn't know we could like go back to certain. I don't think we've done that before, where we like went back to certain tests because we couldn't do them before. But I might be misremembering. But yeah, that was Miami Flatline. So we are done with that game, and all of them for now, because that's the only one. As I said at the start of the stream, they are working on another one, but it might take a while because having to do with licensing and stuff. I think they were able to sell it, or like the whole thing. So yeah. But if that comes out, I will definitely be streaming that as well. So for now, we're done with that. So next week, I'm streaming twice, and it's going to be kind of early in the week. I am streaming Star Wars Outlaws on Monday, because how could I not? It's May the 4th. So May the 4th be with you. So I'll be streaming Star Wars Outlaws at the regular time for that. So that'll be 10 a.m. PT or 1 p.m. ET and 7 p.m. CEST. So that's Amsterdam time. And then on Wednesday, I will be streaming a board game. I just don't know which one yet. I'm working on that. I might announce it on my Bluesky, or you'll just find out when I start streaming. I'll say it on my Bluesky when I stream, but I might not. I'm not sure yet. I have to look into some things. And I will be streaming that at the same time. So that'll be 10 a.m. PT or 1 p.m. ET or 7 p.m. CEST. Again, that is Amsterdam time. And that'll be a board game. Probably physical. I'll probably be using the overhead camera, so I have to figure something out with that. But yeah. Having said that, thank you all for joining. Thank you for watching. Thank you for the subscriptions, the bits, everything. But even just your time, just thank you for hanging out and for saving these two patients with me. So yeah, I hope you have a wonderful evening, day, night, whatever, but definitely life. Bye.